It's the last session of the day, so I bet everyone is super tired. So this session is going to be light, but yet very interesting. It's my pleasure today to welcome you all in the session of digitalization of regulatory affairs. Today we know, as we know, the landscape of the regulatory environment is changing rapidly, and technology and innovation is at the forefront of this change. Today we will have in this session two topics. The first topic is around the cloud-based submission and how this is impacting the future of regulatory affairs submission. And the second session will be around the portals and systems used for metadata sharing across health authorities. Without further ado, the first topic will be hosted and presented by Dalia Fouad. Dalia is a regulatory affairs head for Sanofi and head of science and policy as well. So gonna be very quickly. I don't want to waste your time in the introduction because it's the last session. So please join me welcoming Dalia on the stage.
Hi everyone, I'm Dalia Fouad, as my colleague has introduced me. And as we said, it's the last session. We're going to be short and sweet. So as my colleague said, cloud submission. I don't know if anyone has heard about this term before. Anyone? Even a wild guess? Yes, please. Thank you so much. I'm very happy that we have someone here who knows about Accumulus or the cloud submission. Okay, it's my pleasure to talk to you a lot about it since I'm also representing Accumulus within the international region. And I think that my session follows very well the previous session when it comes to digitalization and AI, because as we all know, this is the future. So if we're not going to jump on board, we're going to be missing a lot. So, okay, this is a disclaimer. I work for Sanofi, but Sanofi has nothing to do with these slides. It's my personal point of view, and I'm happy to share it with you. So today we're going to be discussing the journey of digital transformation in general. What's happening when it comes to digitalization? How are we transforming in everything? Not only when it comes to regulatory submissions, but even when you look at your life, your basic needs, it's transforming. Then we have how are we going to do the e-submissions? Moving to what are the cloud-based platforms and what are the barriers or obstacles that might impact our adoption from a regulator perspective or from an industry perspective. And last but not least, our takeaways for this session. And after that, I'm more than happy to have a private discussion if you would like to know more about the cloud-based. So as you have seen, how much have we transformed? I'm not talking here about Gen Z. I'm talking more about baby bloomers and the millennials. So I think that you might have heard some of these things moving from VHS versus Betamax, the challenge of Apple, IBM, and then the rise of iPhone and the fall down of BlackBerry. So a lot of evolution has happened when it comes to digitalization, and it's more and more evolving. And as you have seen, ChatGPT and more of things to come, and we never know what's next. So as we see in our daily life, the challenges with digitalization, it's also impacting our day-to-day work. And that's where we come with the cloud submission. So this is the cloud. So there is a space for the industry, then there is a shared space between the industry and the regulators, and then you have a space which is only for regulators. It's a complicated slide, but I'll take it. So these are the facilities provided by the cloud submission. So you have data access, data tracking, cybersecurity. So everything that you need to talk about the cloud, it's available. So what is it? And probably in, let's say, an easier term, it's a cloud where the industry submits the dossier and regulators have access to this cloud, where they can view the dossier, they can raise Q&A, which is shared with other regulators. So let's say that Ministry of Health in the UAE would have access to your dossier, and let's say the Egyptian health authorities would also have access to your dossier, and they can share and have a discussion. So instead us as industry receiving Q&As, Regulators would chat together and review the dossier. How does this impact us? It is a form of reliance. We should not deny that. And it reduces the timeline for review of your dossier. Instead of them going back to the industry, asking the question and going back, when two regulators connect, outcomes are always better. This is the journey of ECTD. I know that during the past sessions, a lot of my colleagues have spoken about ECTD. I'm not going to go there, but ECTD is a very important pillar for us to go ahead with the cloud submission. Without ECTD, it would be difficult to upload your dossier on the cloud submission. So it would help a lot, especially with countries where they have already adopted ECTD. And you never know, it might be even a facilitator to have ECTD as soon as possible. The value of the cloud-based submission. It's global convergence, so it's sharing practices between regulators, regulatory efficiencies, because it is a form of reliance where regulators are going to have better view of the dossier. And by the way, something I forgot to say, it's one dossier. It's not going to be a specific dossier to that specific health authorities. It's one dossier. So imagine us as industry preparing one dossier for, let's say, for 100 countries. That's the future. And accelerated digital transformation. So we are still following artificial intelligence, but in a different sense when it comes to submission, approval, and review of our dossier. So where do we stand? And as my colleague has said, they have submitted 3 pilots. So a lot of companies have been going through this. I can name a couple of them because it's not a secret, and they have already issued press releases to confirm their participation. So we have Roche, we have Amgen, and we have Sanofi, who are all part of the pilot, and more companies to come, and more regulators to get involved. So that's very interesting to see that when it comes to digitalization, we're working hand in hand with the regulators. Fresh perspective into things. What is the scope of the submission? It could be post-approval changes, it could be labeling updates, it could be new products. There is no limit to innovation because we can innovate in different ways. And last but not least, which is always the concern when we talk about digitalization and artificial intelligence, is data privacy. Yes, there are concerns, but we always make sure from an industry perspective that the right measures are being put in place to ensure credibility and the insurance of privacy is not hijacked. Thank you very much.
Thank you very much, Dalia. Indeed, it's very interesting. Huh? I still remember those days where I have to print a file that size to go, and if you manage multiple countries, you print 5 or 6 like those. So very interesting. So our next topic is about structured data sharing and metadata sharing and the leverage of portals and tools to share this metadata and how is this accelerating the decision making at the authorities level. So I would like to invite Madelein Terblanche, who's joining us from Vector Life Sciences, and she's traveling all the way from South Africa to be with us here. So please join me welcoming Madelein on the stage.
It's a green play button to go forward, right? So last time I had a big play button on the screen. I don't have one, I have one in my hand now. Like you introduced me, I'm Madelein, I'm from South Africa. We do not have lines on our airport, right? We do not. So some people do believe it, we don't. But anyways, so I would like to introduce you to something I call a whole new world. So portals is that place which is new, it's innovative, and there's a lot that can happen with it, right? We talked about track and trace and ECDD and data and everything, but there's this special place where portals has a crucial role when moving forward into pharmaceuticals, because there has to be some engagement with industry versus authorities, right? And emails are getting kind of obsolete. We want one spot, one source of information where we can exchange anything that goes back and forth. So I'm going to talk about the role of portals in the industry, the benefits of metadata sharing and the automation that goes along with it, how portals improve regulatory compliance and efficiency. So we have an American as part of our team, and he says regulatory. I say regulatory. So depending on where you come from, that's what you say. And then why it matters, these portals, and what's the importance of these. So, as my colleague said, the evolution of data and how we moved from where we were, it was very siloed, it was very manual, very time-consuming, and he spoke about all those papers, right? We moved with boxes and submitting it to our regulatory authorities. The challenges that came with that is there was data fragmentation, there was duplication, so you would submit something in that country, and then you have to duplicate the efforts for that country, very time-consuming. Compliance risk, we might not be compliant to ECDD specifications of a certain country because we're compliant to this one. We might not be on track with the WHO global benchmarking tool. And there was a lot of inefficiencies that went with this. But then there came this shift to digital, and that is where we are. We are in a space where we are moving forward to being very digital, very orientated about sharing data instead of documents and paper and all of that, right? And it's such an exciting time to be alive. So what are pharmaceutical portals? Basically, it's that web-based interface where you type in all your data. I'm applicant ABC, and I'm submitting product CDF, and I want to have information back from the authority. And that is basically what a portal is. So what is the key features of these? They are centralized data access, one place of data, not millions. Role-based access for different stakeholders. So you will have an industry side, you will have an authority side, you will have an administrator, you will have somebody that approves payments. So there's different access in a portal, which will make efficiencies more, better. And then there's a lot of automated workflows and approvals that can happen because of portals, right? So let's take, for instance, small variations. Those do then tell. Instant automated approvals can happen on these portals. So what is the key factor of these portals? We call it metadata, and it's absolutely the game changer. What is it? For those that is not IT like me, it's data about data. So I'm telling you, I'm submitting an application, ABC, 1, 2, 3, and if I want to send it back to my evaluation system at the regulatory authority, the applicant has put it in on this side, and it's received on the regulator side in the evaluation system. What can happen with that is that there is an automation that happens if I'm a quality evaluator, my application, because of the metadata, already gets assigned to my quality evaluator. No need for hands to touch an application to assign it to a specific workflow. It's also the one source of truth. One place, one spot. There's not data scattered everywhere. There's one place that we can look and find our data. So what does it look like? So basically, I will submit something on the portal. I would create an application number, there's an application ID, there is some other information, this is submission type, a new generic, and I press submit. Regulator receives the dossier in their evaluation system already. It's assigned to the new business team, and they start evaluating. Then there is a feedback back to the applicant to say, listen, your application is already in process, or it's under review, it's in evaluation phase 1, phase 2, phase 3, whichever terms your authority uses, and you have instant real-time data feedback on what is happening with your application. It is super exciting. All days you get an email, I have an example. So one day I was submitting an ECDD. I came from industry, so I was compiling dossiers in ECDD till I was blue. And about 4 or 5 months later, the authority gave me a validation error. 4 or 5 months later. What is happening now, especially at SAPRA? Automator runs three times a day. Within 24 hours, you get your validation report. Nobody touched that submission. It's already assigned to whichever unit is going to evaluate that. The value of portals. Wrong one. That one. So over here is an example of a portal that we are busy helping Tunisia design. So you will see in the middle there's something that's called status, it's pending. The moment the authority changes the status of that application to under review or approved, it will change over there. There's a meta sync out where metadata is shared back to the portal to present what is happening to the evaluation system. All of these that you're seeing over here is all the metadata, and some of them you will already be familiar with because you do submit in something which is portal-like, right? But there's this special place of portals and efficiencies that's driven. It's also the one source of truth, and that is coming back to what you said, consistent, interoperable, there's governance and compliance, there's efficiencies, and the scalability. So when you start small and go bigger, it can adapt to all of that. And automation in the pharmaceutical industry, this is part of our portals, which is super important. It reduces the manual errors, so that, for example, I don't get 4 or 5 months later a validation report with an error on. And so, by the way, it wasn't my error, it was SAPRA's error. So, and then it also enhances regulatory submission accuracy. So you would know instantaneously what I did wrong and fix it. And what key use cases are there? There's also AI-powered document classification. And if you want to know more about AI, there is some experts in the room. Automated approval workflow, so quicker and faster and more efficient. And there's real-time compliance checks. The benefits of these, efficiency gains, quicker, faster. Right? Collaboration, there's a bigger collaboration between different stakeholders, there's communication between your applicant and your authority, and there's also better compliance, so there's better ensuring the compliance and adherence to regulatory guidelines. There's also big cost saving, right? Maybe implementation costs may be way big, but as we go along, it's a lifetime investment in portals. Some challenges. And we all have some challenges, right? So there's always data security concerns. There's a need for encryption and role-based access. Integration with legacy systems, old ways of thinking, and these need to merge and integrate. There's always that challenge that we need to face and adopt to. Biggest challenge ever, user adoption, right? So at SAPRA, and I love them to bits, there is kind of this thing about change that is difficult. And we want to help change and be better, but there's something that's like, I really don't want to change. But the moment they adopted it, it was like a bulb that went alive. It was brilliant. And as I said, the initial implementation cost, and then different specification, different regions, different ECDD specs, all of that. Something that we are very proud of is that in Africa, we are starting to align the ECDD specifications. We started with SAPRA. They just brought out the 3.1 specification, which is similar to what is going on in ECOWAS, which is similar to what's going on in Tunisia. So we are aligning Africa to one specification that one click of a button, you can go everywhere. There is, however, minor differences. For instance, our product labeling, that's very specific to different countries. If that is something we can align on someday, brilliant. And imagine you have a portal where you submit e-labeling to, gets distributed globally. Right? Very exciting times. Portals should also comply to ICH standards and for data management, and that's very important when you talk about data. So there's the ICH M8 guideline and also the data integrity guidelines, which is the ICH Q7 and Q9. It should be secure, accurate, consistent, complete, reliable, and system should prevent unauthorized changes to data. So that is where your security encryption comes into, and make sure that whatever portal you do aligns to that. So what is the future? And there was a lot of talk now in the previous session on AI, machine learning, predictive analytics for better decision making, expanding for global collaboration, regulatory systems, and that is the example of the IDMP. There's a Project PRISM in the US FDA, which they are doing on a cloud-based solution, and also the Access Consortium, where several countries are already busy doing one cloud and submitting into one space for one evaluation. One dossier, a lot of countries gets evaluation. So what is the conclusions? Portals are transforming the pharmaceutical landscape. Be aware of them, look out for them, they are exciting. Metadata sharing improves transparency and traceability. We talked about track and trace. Portals can be part of that track and trace place for the pharmaceutical industry, between regulators, industry, and all of our partners in track and trace. Automation reduces the errors and enhances compliance and saves time. And future advancements like the AI will drive even greater efficiency and innovation. And I basically just concluded what this conference was all about. Let's go forward to the future with driven innovation and something new. And that is that from me. I have a video.
I can show you the world, shining, shimmering, splendid. Tell me, princess, now when did you last let your heart decide? I can open your eyes, take you wonder by wonder, over, sideways, and under, on a magic carpet ride. A whole new world, a new fantastic point of view. No one to tell us no, or where to go, or say we're only dreaming. A whole new world, a dazzling place I never knew. But when I'm way up here, it's crystal clear that now I'm in a whole new world, a new fantastic point of view. No one to tell us no, or where to go, or say we're only dreaming. A whole new world, a dazzling place I never knew. But when I'm way up here, it's crystal clear that now I'm in a whole new world.
Thank you very much, Madeleine and Dalia. And it's very clear how these two topics complement each other, right? It's about the dossier submission itself, but also at the same time, the metadata and structured data sharing with the health authorities. So now we have prepared some questions, but I would like to check first if any of the audience have a question so that we give an opportunity for questions live from the audience. Anyone would like to ask a question? Yes, please.
I am Hadil Sukkar from Jordan, Amman Pharmaceutical Industries. Actually, I want to ask about the cloud submission. Which authorities can check the files through it? Is there any authorities linked to this submission, or it's still a draft, for example?
Thank you very much for your question. No, it has already, like Roche has implemented a pilot last year with more than 50 countries. And the press release, it's out there on the Google. You can find it. You can have details about the post-approval change that they have submitted, about the authorities who have participated in the pilot, and the variation has been approved through Accumulus.
Okay,
So it's work in progress.
Okay. The GCC authority is one of these?
Some of the countries, yes.
Okay, okay, thank you.
We would be happy to have Jordan on board.
Okay, inshallah.
Anyone else would like to ask questions to our speakers? One more hand? No? No. Ah.
I'm Dr. Jihan Khalif. I work with Aspen Pharma, and I was working with the Ministry of Health of Tunisia for 10 years. So I will start by just congratulate you for the efforts that you have made in Tunisia. I have the feedback since I'm in charge of MENA market. And I'm asking about the readiness of all the stakeholders for this transition, because I know with this transition from the DPM to the agency, it's already a big challenge.
Yes.
And this challenge to ECTD and the online submission, it's a dream coming true.
Yes, no,
It's a
absolutely.
dream coming true.
Yeah. I just want to compliment the Tunisian team. So it was really a group of driven individuals from the DPM that drove this project, and without them, this wouldn't have been possible, right? So we were the help, but they were the drivers of this. So that's, if you are implementing ECD, I know Kuwait is next. If the individuals in the authority is not going to drive it, it's not going to happen, right? And the industry can push as hard as they want, but that's the authority that needs to take ownership and do it. So I just want to compliment them and just give them the honor of doing that. Yeah.
In fact, my question, to be more precise,
Yes.
there will be like a transition period, like a pilot period to get just
Yes.
to train it to this huge transition
Yes.
between just printing the files and submitting and then.
No, I do completely understand. There is a transition period, so you are able to submit e-submission for the next year, and then they have 12 months until implementation for ECD for pharmaceuticals and biologicals. The medical devices and all of that, they are in process. I think this is a 5-year project that they're busy with, so they will come afterwards, but you still have 12 months to integrate from paper, the paper e-submission to ECTD.
Great, thank
Yes.
you. My question now for Sanofi, just about the interesting presentation. My question is, so the cloud is owned by the pharma, not by the authority, you mean?
No, Accumulus is, like you can say it's an NGO. It's not owned by pharma. It's a standalone that is working with pharma and with the regulators.
Yeah, I know, but I mean, in general, clouds are very expensive. We pay a lot of money for iCloud already. So who is just paying or renting this cloud?
It's Accumulus.
Okay.
So you're going to be using the cloud from Accumulus for the submissions and for the review.
Okay. Thank you.
You're
Thank
welcome.
you all.
Okay, so as we promised, it's gonna be short and sweet. So we'd like to thank our speakers and thank you for your attention and interaction. And I think I will hand over back to Catherine for the wrap-up and closure of the meeting. Thank you very much.
Thank you so much. Thank you, Dr. Mohamed.